An inewsource survey reveals 2 years ago, flu vaccination rates among healthcare workers were as low as 67% in some local hospitals. Now, most hospitals report percentages in the 90s. Health officials say that's because San Diego's chief public health officer issued an order last November. It requires all healthcare workers to get a flu shot or wear a mask. Joining me to talk more about the county mandate is inewsource health reporter Cheryl Clark. Cheryl, why have healthcare workers in the past been reluctant to get that shot?
Well, Kenny, like regular people, non-healthcare workers, a lot of healthcare workers have mistaken beliefs that the flu shot doesn't work or that it will make them sick. Some have religious beliefs against it. Some people just don't think that they will ever get the flu. I think there's been a disconnect between getting infected and transmitting the influenza virus to patients. And people say, well, there's no proof that this patient who got sick in a hospital was infected because I had the virus. There's no real chain of custody there, if you will. There's no way to prove that. And so there has been some reluctance. I think the mask or immunize mandate from Dr. Wooten has put a lot of healthcare workers in the position of realizing, oh my gosh, I'm going to have to get a sticker. I'm going to get a sticker on my badge that says whether or not I'm immunized, and people are going to know if I'm not, and they're going to know I'm going to have to wear a mask, and I really don't want to wear one.
Now, we spoke to some healthcare workers that did get a flu shot. Let's hear what they had to say.
I'd much rather have the shot than get sick. I can't afford to take the time off from work, and I don't want to expose the rest of my family, especially my grandson.
I remember last year how much our census increased during flu season, and so just being aware of how the flu affects people, I'm just willing to go get my flu shot so it doesn't affect me that way, and so I can be here to do my job to take care of our patients.
So Cheryl, what is the rationale behind this order from the Public Health Department?
Well, the rationale, I think, is to, as I said, to try to get healthcare workers to realize that they can do one of two things. That is, get immunized or wear a mask. Masks are uncomfortable, though, for a lot of people. They get. I quoted a physician who said she couldn't wear one. She'd have to take it off because it's just too uncomfortable. It also impairs communication with patients. You can't hear. It might even be scary to patients if you're waking up from anesthesia or if you have some cognitive issues. So I think that has been very influential.
What are the latest flu vaccination rates at local hospitals?
Well, Kenny, I believe the stats that we received from the various hospitals were as low. Paradise Valley had 77% of its healthcare workers who work in patient care getting immunized in the 2014-2015 flu season. Alvarado had 87%, and UC San Diego Medical Center 87%. There were a number of hospitals that greatly improved. Palomar Palmerado went from the 70s to the 90s.
So Cheryl, lastly, how well is this year's flu shot matched with the flu virus that's floating around? And
I should have mentioned that a lot of the recalcitrance in past years has been because people were skeptical that the vaccine worked. Last year, the CDC said that the match was only 23%. Between the vaccine and the prevailing community virus. This year, Tom Frieden, the CDC director, said in our news conference last week that he expects the vaccine match to be much better this year.
Okay, great. Let's leave it there. Thanks, inewsource reporter Cheryl Clark.